Welcome to Well Since You Asked Me, the podcast where curiosity sparks conversation. I'm Lynn, your host. In this episode, we dive deep into the complexities of trust in the healthcare system, particularly for Black patients. From historical biases to modern-day disparities, we explore why many in our community delay doctor visits and how systemic racism still impacts patient care. Our guest, Monica, a nurse educator, sheds light on the challenges Black patients face, the importance of advocating for ourselves and loved ones, and the essential health screenings we often overlook. We'll also discuss how to build trusting relationships with healthcare providers, why Black patients are often undertreated for pain, the role of preventative care and community education, and actionable steps to advocate for yourself or a loved one in a medical setting. Join us as we unpack these critical issues and empower ourselves with the knowledge to demand better care. So grab your favorite drink, get comfortable, and let's get into it. Monica, welcome to Well Since You Asked Me. I am truly honored to have you here today. For over 30 years, you've played an essential role in the success of one of California's top hospitals. As a registered nurse with specialized expertise in telemetry and cardiac care, you've not only provided direct, high-quality care to patients, but you've also dedicated yourself to educating and mentoring fellow nurses. Your commitment to both patient care and the professional development of others is truly inspiring. So let's start with you sharing your background. Will you start by sharing how you got started in nursing and healthcare?
Oh, hi, Lynn. Thank you so much for having me. I really appreciate it. I had always wanted to become a doctor. I wanted to be an OBGYN doctor, but life happened, and so I changed that. But I know I wanted to do something to help my fellow person. So nursing was the best way to go for me.
Mm-hmm.
And so I went there. I started, I was a single parent with three kids. So I had to take steps, couldn't do it all at one time, but I was like a certified nurse's assistant, working my way up. I did the hospital part, then went over to the clinic as a medical assistant and licensed vocational nurse, and then a registered nurse. So I paid my dues, starting from the bottom and working my way up. And so that's how I got started.
And so nursing for me is such a important part of the hospital, right? So I had my two boys and the nurses really helped me as I am not a fan of going to hospitals or doctors at all. And I can say that that nursing staff was instrumental in me, being calm, having the boys, and I felt so cared for. What about nursing was important to you? What was appealing to you?
Just the compassion to have, for people, because like you said, when you're going into the hospital, nobody wants to be there. You know what I mean? So um, when you're going in there and you're scared, and most of the time patients don't have medical background, they don't know. They have it now more so because they have Google and AI and all this
Mhm.
stuff, but still, um, it's a scary place. No one wants to be there. Everybody's more comfortable being healthy and at home. And so allowing people to um, trust you, building that rapport, and, just kind of letting you know what's going on, that kind takes away that fear. When you're
Yes.
going in there and they're talking about all this medical jargon that you don't have a clue as to what it is, even if you look it up, you still not knowing, but just speaking in a language that people can understand and let them know that you're there with them every step of the way plays a major role in that bond that you have with your nurse, you know?
It's so important. Last week, we had an episode where one of our guests shared her journey through breast cancer. And one of the things that she said was that you needed to trust your healthcare professional. And I think that what you're saying about the trust is so important. Just a quick story about myself. I am not, like I said, I'm not a fan of going to the doctor. Unfortunately, I sometimes treat it like I do going to a car mechanic, that I don't want to go because I'm sure they're going to find something. And so typically, if I go visit my OBGYN, it's a 10-year visit, and they're like, oh, you're here. I will say that our guest last week and another friend of mine have really helped me to be more attentive to my healthcare and not do those 10-year stints. But I do have that thought that, okay, if I'm going to go in there, they're going to find something. And unfortunately, I'm also the kind of person who's like, I'm probably not going to do anything when they do find it. So I think it's important to develop those relationships with the nursing staff, with your doctor. Um, what are some of the things that are glaring disparities between, like maybe Black patients in particular and doctors? Because for me, I sometimes think that our community will go to the doctor as a reaction as opposed to being preventative. Do you see that, or what do you
Oh,
see?
for sure, for sure. I mean, within my own family, they are not,
Mm,
they are from the South. Older, much older, so they don't have that where they're going to go in and just do preventive stuff. They want to wait again, like you said, to the last minute, and they're afraid that if they go, because they have waited so long, that they're going to find something, and
mm,
then that's why I don't go to the doctor. But I just feel like um, the trust is not there with medical providers and Black people, and it's
mm.
our history.
Yes.
Um, and so it is scary. And then to be honest, they do treat you sometimes, most of the time, based on the color of your skin.
Oh, wow.
We're in 2025 and they still are biased. So it's hard for us to, as a people, to go to the doctor and really put all of our trust in them.
Mm,
Sometimes even when I go and I do my preventive stuff because I'm in the medical field, but I have to say I'm a nurse before I feel
yes.
like they won't take advantage of me because I know what I need and because I'm aware of
Right.
the stuff that goes on in the medical field and I shouldn't have to say that. And so that
Absolutely.
frustrates me and that's why most of us we don't go because they don't know the medical stuff and you have to build that rapport. But if you're with somebody that, at your primary care doctor's office, for instance, and you hardly ever go, then you're not going to have that rapport with
Right.
that doctor or with that nurse.
It's interesting. That's a
So
good
getting
point.
in there, yeah, it's very hard to go in there, and then again, by the time you do go, they may find something. So it's just scary all around.
So you mentioned something about, the bias and the color of our skin. How or have you seen systemic racism or explicit bias show up in healthcare settings? Do you have an experience with that, or how is that usually, showing up when patients come in to the doctor?
Well, I'm an educator of the staff, so we teach not to um, treat people, differently based on their race or their
Mm,
sexuality and all that different kind of stuff. But of course, people still have that in them, and they do.
hmm.
Again, when I go, sometimes I have to mention that I'm a nurse before I get the respect as a person
Wow.
that's being treated. You know what I mean? So, and then just recently, my brother was in the hospital, and you know, because he's Black and he's a recovering addict. He's in recovery now for 27 years. He had them treating him like just trash on the street. And I was going to go to the hospital and turn it upside down. But he was like, no, just let it go, just let it go. But it was like, I had to speak with that nurse. Like, why are you treating your patient like this? He's in pain. And they did not want to give him pain medicines. He had hallucinations from the pain
Oh.
medication. However, if they had been doing their proper assessment of him, once you give a person pain medication, you're supposed to go in and if it's oral, like in an hour to see if that helps alleviate the pain. That's one of the vital signs. So if they're taking his blood pressure, temperature, respiration, pulse, they should also be addressing his pain, especially when he's in there for having surgery on his leg. They
That
know
is
that's going to be one of the
interesting.
key tests, right? And so the guy, the nurse, obviously didn't do or reassess him after giving him the pain medicines to know that he had hallucinations. And then he's begging for payment, and I was like, he shouldn't even be having that. But had you done your assessment like you were supposed to, you would have known that. Because he was like, well, nobody told me. Well, you should have went to him and did the assessment like you were supposed to, and he could have told you. But
Mm,
because he was black, I mean, left him at the on the commode, and he's a fall risk, and he's supposed to be within arm's reach of him in case he falls. And I was like, well, where were you? My brother said, oh, he walked out the room, never even came back. And I asked him, well, where were you? Thinking he was going to say, oh, I was outside the bathroom door. He was like, no, I stood out the room door. I was like, really? Like, it's just, and didn't have an attitude like, I'm sorry. He didn't want to hear it. And I was like, I was just one up the chain of command. I'm going to talk to the primary nurse, then I'm going to take it to the charge nurse. And if they don't do anything, then I'm going to take it to the manager of that unit, and so on and so forth. And then I was going to call the state, because had my brother had fallen, then they would have been on their P's and Q's trying to, do damage control. But why? When you should have been doing that from the start. You know what I mean? So
absolutely. And he is so fortunate to have you and your experience. But when we think about just everyday people advocating for themselves or, even for a loved one in that setting, what are some of the things that they can do? I heard you talk about the pain medication and doing the assessment. Is that something that we should be asking for if we're not seeing that being done? Or in your opinion, what can we just do?
definitely. When
Mm,
like I said, the vital signs, if you're going in there and you're complaining of pain anywhere, that is part of their vital signs. So if they're giving medicines, they're supposed to make sure that they're coming back. If they're giving a intramuscular or sub Q or whatever, if they're sticking a needle in them, then they're supposed to come back within 30 minutes to check and see how was your pain. What is on a scale from 0 to 10, with 10 being the worst? What is your pain level after the medication? They're supposed to be checking that. That's vital. That's a big thing in healthcare, pain management. And they think Black people can handle pain.
mm,
You like they don't need to do all that. And that's the same way when women go through childbirth. Black
yeah.
women, it's been historically um it's a historical thing of them letting them suffer through labor and all that, because Black people, they can tolerate a lot of pain, so they don't
Hmm.
they don't care really. And it's very sad we're in 2025 and still doing that. But you have to be your own advocate. And I get it, a lot of people don't know about medicine and the medical field, and so they trust their providers. And I'm not speaking for every provider, that, because you do have some good ones out there, but it's just, long standing with African Americans, we get the short end of the stick all the time.
But that's good advice. And so, at least in what I'm taking away from that is making sure that if you are in the hospital, if it's you or someone that you care for, that they are doing those checks. They're doing the pain medication, or excuse me, pain checks, and making sure that you're at least getting that, because you're absolutely right. Historically, we have been put into this situation where, oh, you're black, you can handle it. Well, I'm a
Mm-hmm.
human and it hurts. So there's that as
Right.
well. So that's
Absolutely.
it. And another thing that you'd mentioned, like I want to talk about earlier, you said that as a trainer of new professionals coming in, that part of that training is the bias, is to make sure that they are being at least aware of that. Is that something that's new to the medical field, or did you go through that when you were coming up?
Well, to be honest, 30 years ago, definitely didn't go through any of that.
Mm,
I don't know, because I've only been in the education department like a year and a half, so
okay.
I see it more now. Um, I know my niece is a nurse as well. She's a NICU nurse, and when she came to her hospital, they had a whole presentation on African American and
Wow.
women. And I had never seen that before. Like I mean, in Southern California, I don't know of any other healthcare organization that showed that kind of information regarding African American women in childbirth. I was just kind of blown away, and I was
That's
pleasantly
amazing.
blown away. Yeah, because the company I worked for, no, we didn't have any of that. And now, like I said, they talk about that all the
That's great. So one of the things that at your particular facility that you're at, they're really good at preventative care. And when you think about patients, black, white, whatever, that what are some of the things that we could be doing to ensure that we're doing preventative care?
So I think just educated about preventative care, and that usually entails, most Black people go to church. So, like having those little health fairs at the church, like community centers, they have like outreach and education type things that they can, be a part of. Um, just mostly community stuff. It's just hard to health insurance, if you're on the county, like, your state insurance or whatever, like for poor people, whatever, you're going to be treated different
Mhm.
because they know that those, and and I'm not saying that they don't want to do the best for those people, but then the government kind of limits what they can do, not the preventive part, but like if they already have a disease process going on. So they kind of limit that. But with my healthcare organization, it's all one. It's even though it may be the county medical per se, it's under the same umbrella. So nobody knows what your health plan is. So they're more prone to treat you more equal than like an outside facility.
Interesting. That's very interesting. So,
Yeah.
are there any specific health screenings or checkups that you feel that the Black community should prioritize that we sometimes don't do?
For sure. Yeah, diabetes check for sure. Breast screening. Our Black women, we need that. We're more prone to that. Cancer screening, so getting their pap smears done. Also, colon cancer. If you're 40 or older, most health care plans send out the little fecal testing kit. You can do that, but making sure that you definitely get those done. Getting blood pressure checked because we have a high rate of high blood pressure
Yes.
or hypertension. Um, just those are the main things, though. The
Hmm.
hypertension, the heart. So dieting, not being on a diet per se, but just eating healthy. And
Hmm.
because most Black people don't have the financial resources, it's hard for them to get healthy food. It's easier to go to McDonald's or something to get, though it's cheaper versus the healthy stuff. It costs so much, and if you have a big family, you know what I mean?
Yeah.
It's just really hard for them.
It's hard for that, and also if you are in a food desert. So if you're in an area where you can't get fresh fruit or
Mhm.
vegetables, and so right, you may be prone to have that fast food, which is really unfortunate. And maybe we'll explore that in a different episode. But sometimes it looks like it's designed that way, right? One of the things that
Yeah.
we do in our family is that we have a garden, and that is something that I took on from my grandmother, but my kids, they have always had a garden, and so we have access to it in the backyard, but not a lot of people have that opportunity. And so you're absolutely right. When your diet is not as healthy, and then it's just going to have a ripple effect, right? And so I think this is super important to hear about those different things that you need to prioritize because we do sometimes live in areas where we can't get what we need. That's very helpful.
Mhm. Mhm.
Yeah, so when
Yes,
we
for
think
sure.
about some of the resources and organizations um, for people to get involved in healthcare advocacy, do you have any thoughts on that? If somebody wants to learn more about it and how they can advocate for themselves and get educated in that area so they can have I guess, better conversations with their healthcare provider when they're going in? How can they educate themselves?
So there's some initiatives that focus on African American healthcare, like African American Wellness Project. Um, it helps the health disparities. So it provides us with like different resources and education. And then there's also the U.S. Department of Health and Human Services. They have a program that helps the health disparities as well as the Office of Minority Health Initiatives. And then they would just need to also follow up with their local initiatives, like their community-based programs in different areas. I know that if there's a Black Nurses Association, kind of be get there with them,
Hmm.
reach out to them because they have a lot of health fairs that go on, to for the senior community as well as just the regular community to check blood pressures, to do physicals, to give shots if needed. So those are a few places that really help.
And that's very helpful. I
There's
will make sure that I include that at the end and on the website. Thank you for sharing that. I'm sorry, did you have something else that you wanted to share?
Oh, no, 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 no. I was just trying to think of more other ones, but it's more, it's the local. Those were just the federal ones, but the
Oh,
local, they would
okay.
just have to out to different local their local communities
It's
about
very
it.
helpful.
Yeah. Because
So,
definitely if they're doing these routine screenings, their blood pressure checks, their cancer screenings, that really does help save lives. I am a 23-year breast cancer survivor myself. And had I not gone in for a screening, and at that time I had no family history of breast cancer. So
mm,
I thank God every day that I went in and got, and it was just a voice from God that told me because there was no other reason for me to go. I had
oh,
just
wow.
done my health assessment. I had a whole physical from top to bottom, had all the blood done. They said I had at the time was the health of a 16-year-old. And then something just said, go get a mammogram. And I had to fight tooth and nail because again, I wasn't old enough, but
Mm.
I got it done and thank God I did because now I'm here.
Wow, that's amazing. I think about like some of the different tests that we have to do as we get into different age groups. And I remember like for me for getting a mammogram, I procrastinated so long because I just had this fear that it was going to hurt. And you hear all these horror stories. And I remember when I finally went, I was like, wow, nursing hurt worse than this. And so I think that sometimes we create this fear in our heads and it stops us from actually going to get those tests. So there's a lot of things like getting your colonoscopy. There are things that people have told stories that for at least for me
Uh,
caused this fear and then I didn't want to go get it done. I will tell anyone listening, the colonoscopy, the mammogram, it was literally nothing. I didn't even realize that I'd been in there getting a colonoscopy. I woke up and I was like, oh, what happened?
no,
So,
yeah, me too.
yeah,
Yeah, it's just the fear of the unknown. You don't know, you
right.
know, and so that's the fear, but those things really do save lives. It's not cliche; they really do
Hmm.
save lives. The sooner you can go in and get it done, the better. Even if there's something, if they can catch it early, you have a way
Hmm.
better chance. So I advise each and every person to go in and get everything blood testing.
Oh, for sure. I think that
All that stuff.
for
A lot of people don't like
mhm.
needles, but hey, it's worth.
No.
No, I was just gonna say it's worth going in and just get a little poke versus maybe something you would have to go through a lot worse. Um, if they if you didn't go in, on a preventive basis. So
So when you come across a patient that's like me, that's reluctant, that doesn't want to do anything, that's afraid of all of these um, ghosts that are in my head, how do you get those patients to, just calm down, to understand what's going on? Do you spend time with that, or do you just like, just let's get it done and let's be done with it?
Oh, usually if you spend time and talk to them and even print out something so they can read or read it to them and
Mm,
let them see how it works, they're more prone to, do it. Of
yeah.
course, if they don't know, then they don't, have an idea. Or if it's something that I've experienced and I tell them everybody's different, but for me, it was this or it was that. You know what I mean? But, it's
Yeah. A couple of things that I've heard
better to
that
get
are
it done than to not. Or I get their attention.
absolutely.
Education is key for sure. Have to educate them.
Well, there's a couple of things, right? So you're talking about you provided some resources so people can do self-education. There are developing that relationship with your healthcare providers, and so going and being able to have those conversations with them, those trusting
Mhm.
conversations, and then doing that preventative care and getting over that fear that's usually worse in your head than it is in actuality. Those are some of the things that I think that are important things for everybody to prioritize and to think about as they're going in to advocate for themselves and do that preventative care.
And then if they don't, if they don't understand, that's the thing too. Making sure you have your provider or his or her nurse or whoever, the medical assistant, if you're going in for preventive, if you don't understand, ask and ask again and ask again. Make sure you understand what's going on because it's their responsibility as healthcare providers to give you that information. And it's supposed to be the instructions or any instructions that they give you after visit summaries or whatever are supposed to be at a fifth grade level so that it is understandable. But again, sometimes you don't understand. So you just advocate for yourself. I don't understand what this is saying. It as many times as it takes, ask and get that
It's
understanding.
great.
But that's going to be the key as well for you to continue to go in or you to really know how important certain things are, especially if you've been diagnosed with a disease process. Well, I don't understand how this works, and I don't understand what medication I'm supposed to take. How is this, and
Mm.
how often am I supposed to get my blood drawn for this, or whatever the case may be? Asking and getting until you get the answer that helps you understand that.
Yeah,
That's
I
what you
love
need to
that because we sometimes are intimidated
do.
by the fact that they are healthcare providers, they have this education, and I probably should know this, or I should, or I'm bothering them. But so that's really excellent advice is to continue to ask, and that is their responsibility to ensure that you walk away from that interaction with the information that you need to be successful and healthy. That's great. Thank you for sharing that. So, Monica, I know that it can be challenging being a nurse because you're going through and you're seeing all kinds of things. What are the things that keep you motivated to keep doing this work and despite the challenges?
Because I want my goal is to help people. I love helping people in whatever aspect that looks like. That's what keeps me motivated. And now that I'm in the education part with these new nurses and even nurses that have been nurses for a while, just, trying to be, I guess, their cheerleader to keep them from being burnt
Mhm,
out because it
mhm.
is, it's a thankless job a lot of the times. You see what you do for patients,
Right.
you get the thanks for it. So just trying to keep them encouraged, but also making sure that they're doing proper procedures and taking care of their patients the way they should be taking care of them. And also that compassion. You can't teach compassion. You
Mhm.
can preach it, but you can't
Yes,
teach it. So they,
right.
a lot of nurses, they have to have that, in order to be it because that job is hard. It is very
Hmm.
stressful depending on what unit you're on.
When you think about that, you think about when you first started being a nurse and the nurses that are coming in now, are there different characteristics, skill sets that you're seeing, or is it pretty much the same? Has anything been significantly changed over the last 30 years in terms of the nurses that are coming into the field?
Well, when I came in, they would always say the nurses eat their young. So when I was a new nurse, I was
Oh,
really afraid of that because, that they were not as friendly, I guess. I never experienced that personally, but that was the going thing.
uh,
I see that now the nurses are even more helpful. And
okay.
that's a thing. I don't think it will. That also depends on what unit you're on as well. I think like in ED, emergency room, ICU,
Mhm.
and labor and delivery, those nurses may still kind of eat their young because those are high stressful units. So they don't always have the best reputation. But if you're like on a med surge floor or a med surge tele floor, those people are more giving and open to help you succeed. Um, and that may be because they're short and they just want somebody to stay. I don't know, but that's what I've noticed.
Okay.
In education, which is a good thing, because with
Yes.
anything new, it's scary, and so these new nurses come on and they've gotten all the theory and some of the clinical experience, and now they have to be on their own. And so having that person that you can go to that is going to support you and give you constructive intervention in
Yes.
information, that's awesome, so I think it's changed in that aspect. um, Back in the day, I think we didn't have all this technology, so I feel like you really had to know your stuff versus some of
Hmm.
the things now because they can just Google everything. And I don't say that they all do that, but I'm just saying it's much more easier for resources, for
Yes. So I'm going to have to ask, what does the expression eat your young mean? What does that refer to?
so they are not friendly. They are not ones that you can go to for help. So you
Interesting.
can't utilize them, to help you out in situations you don't know. It's like they kind of like make you feel stupid. You should know this stuff.
Oh,
You're a nurse too, or just
ah,
have different attitudes toward the
interesting.
newer nurses. Yeah. So
Okay, got it. Yeah, thank
yeah.
you for sharing that. I was like, what does that mean? Well, Monica, before we're almost out of time, is there anything that you think that our listeners should be aware of or any last minute comments? Because I think that you provided a lot of very valuable information. And like I said, I will go ahead and link those resources that you talked about in the show notes and also on the website. But as we close, is there anything else that you would like for us to take away from this conversation?
I just want to say, encourage each and every one, no matter what color you are, and especially if you're African American, please be your own advocate. If you have access to Google or whatever, and you're going in and you have questions, just kind of Google what you should ask your provider, and if there's tests, obviously you want to get the information from the horse's mouth, so to speak. So again, make sure you're asking the right questions. If you don't understand, please continue to ask. Um, and know your chain of command. If you go into
Mhm.
an appointment or you're in the hospital and you're not satisfactory, there's someone always above. So for instance, if there's a nurse there that's not treating you right, she has a boss. So you get supervisor. If there's a doctor that is not treating you right, he or she has a boss as well. If you have to
I
call
love
the,
that.
if it gets to that point where nobody's listening to you, they don't want state to come to their facilities. So, just reach out to, go up the chain of command. And if they don't do anything to resolve your dissatisfaction, whatever that may be, then reach out to your local state, um, not auditors. I don't want to say that, but your regulatory people to get
That
it.
is great. Yeah, for sure. I love that. And so one of the things that I love doing is being the Black Karen, and I call myself Blaren. So be a Blaren and advocate for yourself. I love that.
Sure.
So as we,
I
what did you say?
I said I like that, blaring.
Yes,
Okay.
be a Blaren. Okay, so we're getting ready to close out. So let's do well, since you asked me. So I'm going to ask you, what is your favorite form of self-care? How do you what do you do when you are feeling like I just need a hug? What do you do?
Well, for me, that my bathtub, it's a big bathtub. I
Mhm.
get all my candles and my
Oh, that sounds great.
soak and listen to music, gospel. So that's my sanctuary. That's
I
my
love
self.
that. That is beautiful. I like to get my great grandmother's china, and then I will put a blueberry Pop Tart in the toaster and eat it off of that china, and it just gives me joy. So uh, that's for me. Well, Monica, I appreciate you being with us. It was a pleasure speaking with you. You gave us some really great advice. I, I'm hoping that everybody will advocate for themselves, educate themselves, be that Blaren. And I wish everyone an amazing week. And we will be back next week where we will talk about some other issues that I hope that will be interesting to all of our listeners. But other than that, Monica, thank you so much for joining us.
For having me. It was my pleasure.
Absolutely. Thank you. So that's a wrap for this episode of Well, Since You Asked Me. I hope this conversation left you with something to think about, something to question, or maybe even something to share. As usual, I would like to thank our executive producer, John Dunson, audio and video technician, Ryan Sexton, and graphic art designer, Ellen Jacobs. If you enjoyed today's discussion, be sure to subscribe, leave a review, and spread the word. Until next time, stay curious, stay open, and keep asking the questions that matter. Bye.